Chuck Peterson, Manitoba Beach, good morning.
Good morning.
I'm just going to say simply that I don't care. My wife and I have this, we don't have children. My wife and I are agonizing over this thing. We don't see it as Republican or Democrat. Where we come to this is, this 2,000 pages is going to grow government again. I think that it's going to allow the government to control much more of my life than I would choose it to be. We called your office. We're going to try to get up there, Jackson. We couldn't get the figure on how your calls have been going. How many people are for this, how many people are against it. I can't find people for it. And maybe I'm not looking hard enough. I'm talking about my I just think it goes against what the majority of the people say. Now, when the health, and I may be wrong on this, and you can help me out on this, when these healthcare companies that are making all this money, when this bill is enacted, when these things go into effect, and these healthcare companies say, I'm not going to do this anymore, we're all going to
about the health insurance companies?
yeah, then we're all going to be headed to the health exchange. And when this is my own opinion, when we get to the health exchange, there'll be one health exchange option in there that's going to sound much better than the rest. And we're all going to go there. And then it'll be a single pay. I fear that. I don't want it. So my question is, where, to me, you could speak on the single pay health care, because I think that's where it's going to go, and I don't see how that fits in the exchange. But those are just some of my constraints.
Well, and I think this room is a reflection of America. I mean, this is a pretty good focus group, and I understand there are philosophical differences, ideological differences. One of the reasons I supported the bill is that, it's insurance companies that are between you and your doctor right now, and they're making decisions. They are making decisions. In many cases, are denying care and hurting people. When you talk about this exchange, I'll sort of use my guidebook again. For people that aren't covered through Medicare or Medicaid at the lower economic spectrum, or the VA or TRICARE, which is military, people that can't afford coverage now, small businesses that aren't able to afford it, would have that marketplace. Now, I am a believer in competition. I want competition to help drive down costs. Okay, I don't support a single payer system. What this exchange is I sort of read off a number of options that I have in my case. What it would mean is that you would take your money, or a small business would take its money, they get it with help of the tax credit, help afford it. Now, depending on your income, you may get a little bit of subsidy or help. You take that money and you choose. If you want a little higher deductible plan that has no co-pays for doctor visits, great. If you want something that includes a health savings account and that, you can do that. Now, here's where you and I may disagree. I don't think the insurance industry has behaved very well. The 10 largest insurance companies nationally since the year 2000 saw their profits go up 420%.
That's, I'm sorry to interrupt, and I know you had a floor, and this is a great forum for you. It was similar to your own, which we were invited to that also. But some of the statistics that are listed in your handout, and some of the things you say, can I come to you to get?
We'll give you all the sources for those. I'm not making these numbers up. Let me finish.
Yeah.
So we talk about this marketplace where you take your money, again, if you need a little help, you take that and you pick the plan that's right for you. Now, a public option would be sort of like a Medicare choice, okay? It is funded by premium dollars, and that would be a choice. Now, the Congressional Budget Office actually, in their analysis, said that a pretty small percentage of people would choose the public option. And actually what they indicated was they thought sicker people would tend to gravitate toward that option, maybe feeling, again, based on the history of the private insurance company, that they would have some certainty that the coverage would be there. And because sicker people would tend to go there, the premiums would actually be higher. So a relatively small percentage of people would choose that. So they disagree with me. I'm telling you what the analysis is. And so the lion's share of 21 million people, it's anticipated that would buy their insurance through this health insurance exchange would pick private companies. Now, if I'm an insurance company and there are 21 million people that I can now compete for, I'm feeling pretty good about that. There's a lot of money that they have the ability to make. Maybe because they can't discriminate because you have a pre-existing condition, or they can't drop you because you get sick, or they decide you're too expensive. Maybe their profits won't be so high as they are now.
Congressman, I got to correct the record on those record profits. Insurance companies make a 2% margin. 2%. That is not, just because they got big dollars, it means because they got big dollars at the other end.
013.